Hi, I'm Molly. I'm the lead diabetes care specialist here at 9amHealth. I want to review a topic that comes up all the time and is hotly debated. Can type 2 diabetes be reversed? The quick answer is maybe. Let's first talk about what we actually mean when we say reversed. Right away, I want to be clear that reversed does not mean cured. Right now, there is no magic bullet for making diabetes go away forever, regardless of any circumstance, meaning that there's no medication or herbal supplement that will just take away diabetes. Sometimes when people talk about reversing diabetes, they may also say that diabetes is going into remission. So really, reversed and remission will mean the same thing in this context. Reversing diabetes has been defined by the ADA, the American Diabetes Association, and they've defined it as going at least 3 months with no glucose lowering medication while keeping the A1C less than 6.5%. In the past, the consensus has been really that no, you can't reverse diabetes. It's just not possible because it's a progressive disease and you can't stop its progression. But we're finding that that's not really the full story for everyone. Yes, in general, diabetes does progress, which means that higher doses of medication or more intense lifestyle changes are needed over the years to prevent glucose from rising too high. So the good news is that yes, in general, with individualized lifestyle habit changes, this means nutrition, exercise, stress management, sleep habits, etc., it's possible to go off of diabetes and glucose lowering medications completely for some people. And improving the quality of your diet, especially lowering the amount of sugar and carbohydrates. That doesn't mean eating none of these, but lowering the amount and increasing your physical activity are extremely effective at lowering blood glucose. Meeting with a registered dietitian nutritionist and working on your diet and exercise habits has been shown to decrease A1C by over 2%. So that's pretty incredible. That's more than most glucose lowering medications. But the maybe bad news is that the moment you revert back to old habits, the glucose levels will start to rise again. And some of the habit changes that are really necessary to bring glucose levels down enough without meds can be really hard to maintain. That is the reason really why there's been in the past this talking about, diabetes can't really be reversed. It's too hard to maintain the lifestyle that it really requires to keep glucose down at that level once you've been diagnosed with diabetes. And also, because diabetes is a genetic condition, it may not be possible for everyone that's diagnosed with type 2 diabetes to be able to get glucose levels back into a healthy range without medication. So just as there are a lot of people out there who don't develop diabetes regardless of their lifestyle habits, there are plenty of people with type 2 diabetes who are athletes, who sleep really well. They eat a highly nutritious diet, and they just need medication to keep their glucose in their target range. It's really their genes that we have no control over, and the genes that are blocking from being able to lower those blood glucose levels with diet and exercise. Back to the things that you can control. So genes we can't control, but those habits you can. So all of those healthy habits that we mentioned earlier have a great impact on your diabetes management. And not everything is going to be realistic for everyone. So your 9am diabetes care specialist can help you reach your personal healthy habits goals and help individualize it in a way where it makes sense for you and your life. One last note on the diabetes reversal topic. I really want to challenge you to ask why. Why is it important that you no longer have diabetes? Is it the stigma of having diabetes from society or from your doctor? Is it that you don't want to take medications anymore? All of these are really valid reasons, but it's good to talk through with a care provider to see what the best options are for you and your lifestyle and managing your diabetes. So you can talk about this with your diabetes care specialist at 9amHealth or with your care provider. So check out our website, 9am.health, or give us a call. We'd love to help you along your diabetes management journey.